So now I think it's time for to take some questions. I've been told we have about 10 minutes, and I have a bit of a special request this time. I'd like to get some questions from some ladies in the room. We've heard very few ladies' voices today, so I think it'd be good to hear some questions from the ladies present, but not exclusively. Okay, I see one lady there.
Thank you. I'll speak as a lady and also a lady from the north of Ireland. So I just saw in your presentation about Bumbulance that you kept referring to Ireland, and you have a little ambulance in the north. So am I presuming this is an all-island venture?
Yes, at the moment, Bumbulance or vehicles work north and south, but based out of the Republic. But we have started the process to open discussions in Northern Ireland, and next month we're actually talking in London about going into the UK as well. So we're doing we're a reverse of Brexit. We're going in, we're invading. They were here for 800 years, we're going to go over there. There's a shortage of bees anyway, we all know about that. Yeah. But we are going to Northern Ireland, that's one of our plans, and our next plan is to get to 9 vehicles on the island first, and then expand from there.
That's super. I have personal knowledge of 2 little boys who have the same disease, and it just resonates in a very emotional way, and I'm just grateful that you were able to share that with us today. Thank you.
Welcome.
See another question from a gentleman here.
I don't know whether it's a question. It's maybe a comment that maybe raised some questions, and not like Alan's though, not waiting to pick on anybody. I'm Chief Executive of Headway, which is a charity, not-for-profit sector. We provide community services to people after brain injury and concussion. And we were invited today as a result of an encounter at the Croke Park meeting. We have tried over the last 10 years to engage in mergers and partnerships within the not-for-profit sector with spectacular failure, right? Down for a number of reasons. One, because people were immature organizationally, because they were dismissive, because they were secretive about and protecting their own. So this is a very, very timely and very, very useful and broad-ranging engagement. I suppose if I was to say something if I was to contradict Tony on one issue, is that he says the third sector have a voice. The difficulty is there's so many in the third sector, there's so many different voices all shouting and clamoring out, so there is no voice that really represents the third sector. We would certainly welcome, Tony this morning I think mentioned medical versus, the other Tony mentioned, I think it was Tony or, Paul mentioned medical versus social, but I suppose in the life journey of a person, any person, but with a brain injury, there's a medical element, there's a psychological element, and there's a social element. So I'd just like to thank you again for the invitation and for the well-worth initiative of suggesting planning and partnering. So I don't know whether I've said anything there that might provoke some questions.
Anyone like to say that?
I'll take that one. There was a comment regarding ourselves. I've only been in the charity game 6 years, and I do know that there's need for collaboration, and there is a huge resistance against collaboration. Well, I face it weekly, monthly with other charities. I have no problem amalgamating and working with anyone. But I think each organization has a responsibility to voice their own objectives. And again, unfortunately, in this country, is he who shouts the loudest gets heard. But you have to be proactive. You have to have something which resonates with who your audience is. So content is king. The presentations today, they varied in engagement and connectivity. But you have to have the right content and the right message. And that's what that's our focus. And you know, we like to just engage. It's very good to have that opportunity I have today to speak. And I wish more charities, we invited many charities also to come along today. You know, that some people don't want to get involved, but you know, we have to go forward.
If I could add one thing, I love the comment about you failed spectacularly, I think you said. Plaintree, we fail about 9 out of every 10 business development or partnership ventures or other nonprofits. I think there's two reasons for it. And anybody who works in innovation or in the for-profit world knows that any business development venture you go after, 9 out of 10 of them fail anyway, and it's the 10th one that's the big one. But I think in the not-for-profit sector where we've gotten a little bit stuck is being honest about what we're trying to achieve and making sure we're really aligning with like-minded people, right? So I think sometimes we meet people who we think are like us, but they're actually not. So what I've been so impressed with today with the conversation that the Bonds is bringing up is it's all been about mission and culture. So I think in that world, there's plenty of friends, but early in the conversation, becoming very honest and say, here's what I expect from a relationship, what do you expect? And if it's not to be, we move on. But I think one of our limitations is we express platitudes for so long and niceties that we're 6 months down the line now, and then we realize that we're not really, we're hurting each other rather than helping each other. So my goal is to continue to fail often, but try and fail as fast as possible while going through that journey.
Okay, do we have another question? Or is afternoon tea calling?
Hi, Nollaig Bro, manager of the Bonscore Care Village. For our seniors in Cork, I'm privileged, I think, to work with Bonscore. And as Tony said, I think we have, is it Tony or I'm not sure if it was Alan, I think we have to have hope. It was Alan. I think, you know, this is the highlight of the day-to-day for me because my bread and butter is patient-centred care. And I think, you know, we do make a difference to each person's life every day, and just from the moment we meet them, and first impressions go a long way. I suppose I just want to compliment you all today on such a wonderful talk, from Harry to Alan to Tony to Simon. I just say well done and keep up the good work. And I think, you know, we're blessed in the Bonscore to have a wonderful CEO, board and executive and all the team around us and everybody that plays their part every day. And I think we're all on the one journey that we want to improve life for all our patients and our staff and our residents on a daily basis, because who knows, we could be the next person in the bed. And, you know, we have to meet the budgets and everything else, but if we don't have quality and happy patients and staff, we're wasting our time. So well done to all of you.
Thanks, Nollaig. Do we have maybe a last question from the room? No, I think we're good. So now I think we're having a break for tea. And again, I'd like to thank all the speakers for a very interesting session. Thank you.